Let's talk about back pain.
Yeah.
So 80% of our population have it, and it is one of the most common things that we see here at the clinic. And it can be so debilitating, the pain. It could be where people can't even move because they're in spasm, or they're getting it when they're sitting down, or they can't bend, they can't play sport, they can't exercise, or even at night time it's just aching the whole way through the night. So
yeah, I guess back pain can happen anytime, anywhere, to anyone, and it is so common, but it's not normal.
Yeah, totally agree. So let's have a look at it. All right. So when we talk about the back, we do include the upper part of the back here, but we most commonly see it around the lower part of the back, and most commonly people have it right in the center here, which can be around the disc area, or you can have it along the sides here, which might be a facet joint, or in the muscle. These guys are really common places. They're called the sacroiliac joint, or SRJ, and then pain can even extend down into the buttock area and even all the way down the leg. So why? What are the different causes, or why could people be in back pain?
Yeah, I guess there's a number of reasons, and I guess the first thing would be you could have a traumatic injury, okay? Under that category also comes someone who maybe bends over to pick something up and then goes into spasm, okay? Or most commonly what we'd see here at the clinic is people with a slow onset of pain. So quite often that comes from an imbalance somewhere in the body, so whether someone is restricted in a particular movement, or whether they're weak in a certain area, or if there's a timing issues with how the muscles are interacting. So that's the most important part to have a look at.
And I think the physio's role is we need to work out where on your back the problem's coming from.
Yep.
We've got to work out what we're going to do to help it, okay, so that you're not in pain. So that could be massage, could be mobilization, manipulation, dry needling, stretching, loads of different techniques, but specific for where your problem is.
Yep.
And then we've got the hard part. We've got to work out why this has happened. So, if you're going to see someone with back pain, what do you look at?
I've got to look at absolutely everything. So the first part is getting a good history, so finding out why this has come about, and then from there we'll literally look at head to toe. So looking at someone's neck, shoulder, mid-back, hips, knees, foot and ankle, seeing how well they can balance and move, so functional stuff like how well do you lunge, squat, and really trying to knuckle down what's truly causing the back pain. And I think that's probably the biggest point of difference that we'll find is once we find that out and start to work on it, people really do feel like they start to feel a change.
So someone with a problem may need to work on their squatting and then their balance, and may need to work on an area entirely different to the actual back to help their problem.
Yep.
And I think that just really identifies that it's not normal for us to be in pain, and that physio can really help, and people don't need to be putting up with back pain for probably as much as what they are.
Yeah.
So
if you do have back pain, get it looked at.